probably heard the term your thyroid, but a lot of people aren't aware of what their thyroid does unless something goes wrong, right? Thyroid trouble can cause dramatic changes to weight, energy, digestion, and mood. So maybe you didn't know that this is Thyroid Awareness Month, and that's what Dr. Scot Ackerman is here to talk about on the morning show. Good to have you back here, Doc.
Good morning, thank you.
So the thyroid is small. It's like 2 inches long, and it's shaped like a butterfly, but we were joking a little bit earlier. It can sting like a bee, and problems develop, and people go, I don't know what the root of the problem is. A lot of times it is the thyroid.
Right, absolutely. You know, the thyroid can, when it normally works, it's great. It produces thyroid hormone, which we use for metabolism, but sometimes it overproduces hormone, and sometimes it underproduces hormone.
So how do you know when the thyroid's the trouble spot, and when do you go to the doctor?
Yeah, it's hard to know because the symptoms that we get with hyper or hypothyroidism, hyper is overproduction, hypo is underproduction, are symptoms that are non-specific. So for instance, I saw a patient the other day, and it was a woman who I was seeing for breast cancer, and she was telling me that, she said, Dr. Ackerman, I just feel a lot more sluggish than I used to feel, and I'm intolerant of the cold, and I get kind of tired in the afternoon. And so I drew some blood work on her to check her thyroid levels, and lo and behold, she was hypo, low production of thyroid hormone. And we tuned that up a bit. I gave her some thyroid pills, some medication, because we can get synthetic thyroid pills very easily. They're very inexpensive and easy to take. And we adjusted her thyroid levels, and she's feeling great now. She's lost a little bit of weight because that sluggishness makes you gain weight. She's less intolerant to cold, and she feels a little more balance in her step.
So you usually just treat it medicinally?
Yeah, most times. If the thyroid is underproducing, which is really what's most common, and that happens more often in women than men. And it also happens as people get older. The thyroid kind of peters out a bit, and that's easy to fix just with a thyroid pill. If the other side of it, though, however, is overproduction of thyroid hormone. And that happens to people usually a little bit younger, and that's called, sometimes we talk about goiter, enlarged thyroid, producing excessive thyroid medication, and and with that you get an irregular heartbeat perhaps, and you get heat intolerance. In those cases, a little bit more difficult to treat. We treat those with some medications that tamp down the thyroid a bit, or we can give radioactive iodine, which goes to the thyroid and ablates it, or even in more severe cases, surgery to remove the thyroid gland.
So you said more prevalent usually in women than men, so it's a physiology thing?
Yes, it's a physiology thing, but we don't know why, but it is more prevalent in women than men, probably 3 to 1.
So basically, if you have some of those symptoms, just basically go get a blood test, check it out, and easily resolvable.
Yes, see your primary care physician or whatever physician you're seeing, but generally your primary care physician. Make sure you get a good examination, because some thyroid tumors are actually cancerous, or some thyroid disease, some cancerous tumors can produce thyroid hormone as well. So you want to make sure there's no cancer in the thyroid. So they'll do an ultrasound of the thyroid gland and draw some blood work. It's very unusual that it's cancerous, but it can be.
So if it was cancerous, there would be some sort of a other marker that would go, you've got a bigger problem.
So typically, if it's cancerous, we do an ultrasound, and we would see a tumor in the gland, or a nodule in the gland that looks suspicious.
That's when they come see you.
And that's when they come
at
see
the
me.
Ackerman Cancer Center.
Absolutely.
Good to have you here. And you're back in what, 2 weeks?
Yeah, I think so, 2 or 3 weeks.
We'll see you then. Always good to have you here in the morning show.